We found significant reductions in the incidence of severe, disabling, life-threatening, or fatal chronic health conditions in survivors treated across decades from the 1970s to the 1990s. Overall, these results are good news for patients because they show that reductions in treatment intensity that have been made in recent decades have translated to improved health outcomes in survivors. But it's important to note that the risk of late effects has not been eliminated, and that survivors need to be aware of the specific treatments that they received and how those may increase their risk of serious chronic health conditions. And they also need to work with their physicians and be aware of and follow long-term follow-up guidelines. We analyzed data from the Childhood Cancer Survivor Study, which includes over 23,000 survivors of childhood cancer diagnosed between 1970 and 1999. We found that survivors who were treated in more recent decades, so the 1980s and 1990s, had a significantly reduced incidence of serious chronic health conditions later in life compared to survivors who were diagnosed in the 1970s. These results provide important evidence that the strategy of reducing the intensity of treatments has effectively translated into reduced incidence of late health effects and improved outcomes for childhood cancer survivors. That's it.